So this picture here is taken out of the Atlas of the Human Body textbook by Brayburn. And it's a really great dissective shot of these muscles. It's a little bit different than what you have in your book. And I thought it would be slightly more advantageous than just drawing it up again on a two-dimensional picture. So here you see a sagittal cut through both the mandible, the maxilla, and parts of the cranial structure to give you a nice clear view of both the temporalis muscle as it originates on the temporal bone and elements of the masseter here. Now, your book doesn't quite give you a view of this, but masseter is actually a dual-bellied muscle. It has a superficial and a deep belly. And you kind of get a sense of that here with the structure. You get some view of the retrodiscal tissue, some of the neurological tissue behind the line of the mandible here under the external auditory meatus. And those structures, it's neat to see those and how closely compact they are to these large muscles. They are definitely quite close to the pterygoid tissues, which you don't get a great view of here, but definitely get a great view of masseter and temporalis. So temporalis is going to take its origin, as you can see, on the temporal bone, and it's going to insert on the coronoid process of the mandible, which you can get a somewhat distinct view of here, although it's kind of tough. And then with masseter, it's going to originate on the zygomatic arch, that cheekbone that is cut through here sagittally, and make its insertion on the angle and ramus of the mandible. Both of these muscles are performing elevation of the jaw, which would be closing the jaw, in other words, chewing, or what we call mastication. This is a huge role of both of these muscles. Although it's not listed in the book, I'll talk about it a little more, but I think it is of benefit to you guys to also consider temporalis as a retractor of the jaw.